The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon and welcome to this webinar. So thank you for joining us for this webinar. This session will be recorded and there'll be a Q&A session at the end. To ask a question, there's a couple of options. You can raise your hand or using the icon on the sidebar, and then I can unmute you. Or if you don't want to be heard and recorded, then you can write your question in the chat and I'll pick that up at the end. So you can write your questions in the chat at any time and we'll just come to them at the end of the session. So let me start by introducing ourselves. My name is Damien Emery. I'm the Institutional Technical Services and Training Lead for Market North. And joining me today is...
Good afternoon, everyone. My name is Martin Carter, and I'm the Lead Technical Service Specialist for the UK and Ireland.
Glad you could join us, Martin. So a little bit about Ecolab, and I mean a little bit. Our business is focused on 4 key pillars: preserving water, protecting the climate, providing safe food to eat, and to help keep people healthy. So we're very proud to be a supplier to our NHS, meeting their cleaning and sanitizing needs for more than 50 years, as well as through the tough times during this pandemic. And this image shows you one of our plants where we've been making product for the NHS, amongst others. The key thing is that it's all to NHS standards and grades. So in today's agenda, we'll cover 3 main topics: hygienic basics, ensure safe operations, and the best practices across your operation. So let's start with the hygienic basics, and I'll hand over to Martin to run this part. So over to you, Martin.
Thanks, Damien. So yeah, I'm going to be covering off some of the basic hygiene principles which are relevant to good infection control and prevention. And these extend obviously a lot further than just washing your hands. However, we will cover that in principle as well. So if we start off by looking at the very basics of hygiene and risk management, there's 2 critical processes which you'll be familiar with through managing your homes, and that's cleaning and disinfecting. Now, both of these are very, very important in effectively managing risks associated with microbiological contaminations. So cleaning, if we start on that on the left-hand side, cleaning is the process of applying a product to a surface which will help to physically loosen soils, and then you use some mechanical action to remove those soils from the surface. Disinfection is a different process and is more focused on the practice of actually inactivating or killing the microorganisms present on that surface. Now, both of these processes are linked, and they're both very important in managing your properties safely. Cleaning really is a case of kind of reducing the risk of there being sufficient microorganisms on the surface to cause us harm. Okay, so really when the government is offering guidance in terms of reducing the risk of the properties, it's talking about increased frequency of cleaning. So using products which haven't necessarily got any claims of biocidal activity, so haven't got any claims of killing any microorganisms, cleaning will actually remove those microorganisms from the surface and any other soils that are in there. Disinfection is a stage further. So disinfection really is should be something you target to areas which are of higher risk. So things like touch points, or it could be some equipment, or it could be when you've had a confirmed incident of something within the home itself. Now, some disinfection products require cleaning to have occurred first. So these are products which have only been certified for clean conditions standards. Other products are capable of doing both the cleaning and the disinfection in the same stage, and these are products which are certified for dirty conditions. And we'll cover off some of those efficacy standards as we move through this presentation. Now, if we take a look at the different types of microorganisms which you will need to consider when safely managing and reducing risk within the home for your residents, we've got these 3 key categories. And each of these categories require different considerations when you're trying to manage risk, and also when you're trying to select a product and a process in order to make sure that everyone within the property is safe from them. So if we start firstly with bacteria. So bacteria are the largest of all of the microorganisms that we're looking at. Bacteria can live and feed and divide and reproduce on a surface. They need all of the same things that we need as organisms to thrive. So they need a food source, they need access to moisture, need the relevant pH, the right temperature, and they also need time in order to divide and get to a level where they could cause harm to us. Now, another important thing about bacteria is that they can actually produce spores. So when some bacteria, when they're put into stress situations, so it could be that they don't have sufficient food, or the temperature isn't ideal for them to bide, then they'll produce spores, which are really quite difficult for us to inactivate and require some really specialist disinfection products in order to make sure that you're protecting the surfaces from them. Fungi is split into two different categories, and that's molds and yeasts. And the critical difference between a mold and a yeast is a mold is a multicellular organism and a yeast is a single cellular organism. These types of microorganisms can cause issues with spoilage of food, but they can also be pathogenic as well and can cause issues if they can get into the systems. So it's different types of products that you need for killing bacteria to fungi, and there'll be different EN norms and efficacy standards marked on products to show you how and if they're effective against those. And then finally, we've got viruses, which are the smallest of all of the organisms that we have to deal with. And through recent times, we've all become quite familiar with disinfection processes to deal with viruses. Now, viruses come in many different types, and we can easily split them into two groups, enveloped and non-enveloped. And thankfully, enveloped viruses are much easier for us to inactivate through disinfection. Some of the non-enveloped viruses can be a little bit trickier, and they can cause all manner of issues and illnesses with residents and visitors coming into the home. If we have a look at specifically viruses now, and the one that's been kind of taking all of our attention really over the past year or so, SARS-CoV-2, which you'll all be familiar with now as being the virus that is responsible for causing the disease COVID-19. Now, the critical thing about viruses is, unlike bacteria and fungi, they cannot reproduce on surfaces. So a surface can only become contaminated with SARS-CoV-2 if someone introduces that virus to that surface. And if they introduce 10 viruses to that surface, 10 is the maximum number that's going to be on that surface. It's never going to increase from that unless it gets additional contamination from somewhere else. That contamination can come from someone having contaminated hands, as we all know, and can touch that surface. It can also come from bodily fluids, but it more often than not can come from aerosols from that person breathing. Now, the amount of time that virus can survive on the surface does vary dependent on the type of surface and the conditions, but typically we're looking at relatively low survival times on surfaces. And you can see just down in the bottom left-hand corner some examples there, and typically we're looking over a period of hours. But the most the biggest development that we've learned since the early stages of the pandemic is just how long that the virus can be present in aerosols within the atmosphere or in a room when someone has been shedding the virus. So typically we're looking at about 3 hours that it can remain viable in aerosols within the air. So really this brings forward the advice and brings into concentration advice around having windows open and keeping areas well ventilated when bringing people into the home. Now, if we start to consider about how we might want to start protecting surfaces particularly, and when I'm saying surfaces, I'm talking about human surfaces in terms of skin, particularly the hands, but also non-porous surfaces such as those that you'd find in and around the home. Then we want to be starting considering what type of biocide we want to be using that's going to be effective and can be targeted at viruses as a specific organism. Now, biocides is a legal term, and it is set out in something called BPR, which is the Biocide Product Regulations. which is something that was set out by the EU, but has been transposed into UK law as part of Brexit. So the UK law mirrors the BPR as we stand at the moment. Now, biocides are described as any substance or mixture in the form in which it is supplied, consisting of containing or generating one or more active substance, which has the intention of destroying certain microorganisms. So basically, if any product is put onto the market and makes claims about being effective against bacteria, fungi, or viruses, then it is a biocide. And as part of that, it needs to meet certain standards in terms of efficacy testing and also the regulations that it goes through, the regulatory process it goes through before it can go to the market. Now, this process is called registering it under something called Article 55 of BPR. Now, Article 55 is something which normally you wouldn't need to give a huge amount of consideration about as an end user. But as someone who's selecting products that are coming into the home and making sure that they're compliant, there has been some slight changes to Article 55, which do have a really relevant impact on you. So during the early days of the pandemic, you'll remember there was a real shortage on products such as gels and particular and hand rubs. The EU recognised that, and the UK government recognised that, and they realised that the route to market for chemical manufacturers was quite a long process to bring forward products which were compliant with BPR. So what they did is they issued something called Article 55 exemptions. Now, what this meant was that people could bring products to market very, very quickly without the normal efficacy and safety data you would require for a full BPR registration. These registrations were time limited to 180 days, and that time in most cases has now lapsed. So there's an awful lot of product out there on the market which now needs to be removed from the market. And I'll go through how you can spot some of those products, but it's really quite important that you go through that process to make sure you're compliant. Now, I discussed before about there being a number of different types of ways of identifying products that are suitable for different target organisms. The way in which you can do that as an end user is through something called EN norms. Now, I'm not going to run through all of these in front of you here, but it's really just to show you that there's a wide breadth of different types of EN norms, and this is only a very small sample of the ones that are available in our market segment. But an EN norm is a standardized test that a biocide manufacturer must put a biocide through in order to prove that their product is effective. And under BPR, there are set EN norms for each different product type. Okay. So what you want to be doing as an end user is just making sure that the product that you're using meets the EN norms you need to. And it should state that on the label, and it should say what target organisms it's capable of inactivating or killing. Okay, so if you want a product suitable for virus, make sure it's got EN 14476. If you want a product that's suitable for bacteria or yeast, then look at claims such as EN 13697. If we move across onto the next slide, I can kind of show you these in a little bit more detail. And there's an extra layer of complexity, unfortunately, for you as end users, is that under BPR, products need to be registered and tested to make sure they're suitable for specific use areas. And we call these different categories of products, product types. And normally you'll find that the acronyms for these will be PT followed by a number. So in front of you here, we've got two really important product types for the market segment you're operating in. So we've got PT4 and PT2. And the easiest way to split these two different types of biocides is that PT4 is for biocides which are suitable for contact with food contact surfaces. So use in the kitchen on things such as chopping boards, can be used on things like plates, dishwashers, all that sort of stuff. PT2 is all other non-human surfaces. So, and that includes medical areas as well. So any sort of disinfection of general areas, some equipment as well is going to be relevant to PT2. And then also not on this slide, we have PT1, which is biocides intended for direct contact with humans. So we're talking within PT1, that would be products such as hand gels and hand rubs. Now you can see here that we've got different types of tests. And we're specifically focused here on bacteria, just to try and keep it nice and simple. And you'll sometimes look at the back of a bottle and you'll see there's lots of different EN norms for bacteria. What does that mean? Well, actually, if you look a little bit deeper, the process for testing on bacteria is 2 stages. So you have a basic test, which is what we call a suspension test, which is where we test the efficacy of a bacterial product, antibacterial product, in a test tube. And this is a very basic test which proves whether it is capable of killing bacteria. You then have a more advanced test, which in this case is EN 13697, which is a test to prove that the product works on a surface. So it's more reflective of the real world. So always look for products which carry multiple EN norms, one that's got a suspension test and one for a surface test, and it'll mean that that product is going to be more realistic in what it states for its use in the real world. We then have specific claims which become more and more relevant through the pandemic period for virucidal activity. And if we take a look at the next slide, we can have a look at the specific things that you should be looking for when selecting a product. Now, EN 14476 is quite a complicated standard, and I'm sure many of you have gone through the complications involved with this and have seen a huge amount of products coming through to you with varying different claims and huge amounts of data being presented to you as well. And it can be quite confusing to work out what that data actually means, and also working out whether the product is compliant with what you need it to do. Now, EN 14476 is a tiered standard. So there's different routes to achieving that standard and being able to put that on your bottle. Okay, and just because it says EN 14476 on the bottle doesn't mean it's necessarily got the data for SARS-CoV-2. So the data you need to be looking for is either a specific virus claim, which you can see on the right-hand side there is the top of this tier. Now, this specific virus claim means that the manufacturer would have evidence specifically on SARS-CoV-2. Now, this is quite rare in the marketplace because the virus is quite new, and also this process can be quite an expensive route to go down. So if you've got a specific virus claim, it could be for HIV, it could be for H1N1, you name it, any virus type, that data can only be used for that specific virus. What quite often happens, though, is because it's much more cost effective to have one test which will cover a wide array of viruses, is that manufacturers will go down the route where they can get approval for all enveloped viruses. And to do this, they need to evidence data on an envelope virus called Yersinia virus. Now, this is deemed by authorities to be one of the more difficult envelope viruses to inactivate. And they deem that if you can inactivate that, you can transfer that across to any other envelope virus type, and the product will work just as well, if not better, against them. So that's specifically what you need to be looking for. And then further down, we've got the bottom two, and that's when so we've got limited spectrum virucidal and we've got fully virucidal, and they really become important when you're looking to inactivate envelope viruses, but also non-envelope viruses. So things like norovirus, adenovirus, and poliovirus are relevant with those standards there. And really the point I want to make clear to you here today is that there's an awful lot of confusing information out there today, out in the market, and it's hard for you as end users to get past some of it, specifically when manufacturers are trying to make claims that are a little bit misleading. So we're here to support if you want our support. We've also got CSRs in the field, and we've also got territory managers that can support. But we have some material like what you're seeing in front of you now, which can really help you to kind of break through some of the jargon that's on some of the product labels. And I was talking before about Article 55 temporary exemptions. The easiest way for you to be able to spot whether a product is going to be compliant moving forward is by looking at the label. And really, for an approved biocide, you should be seeing efficacy claims on there. So you should be seeing EN norms on the back. You should be seeing the word active written on there, along with right below it the active ingredients in there. So it might say ethanol, followed by the content of ethanol that's in that product. You'll have hazard statements which talk you through how to use that product safely. You'll have contact times, which are really important to ensure that you're going to be getting the relevant biocidal effect to protect your residents. And also you'll have the names and the address of the manufacturer who has the license holding as well. What you need to watch out for is that there's a lot of cosmetic products that have been brought through onto the market which were never intended for use in medical or professional environments. And you can easily spot those through the expiry date symbol. So you can see on the right hand side there that we've got a little pot which is opened and it's got 6M on it. Now that number might vary. It might say 12M, it could say 3M, it could say a multitude of things. What that is telling you is that that product is a cosmetic, and it is this specific one in front of you is telling you that once you've opened that cosmetic product, it will expire after 6 months. Now, if a product is a cosmetic, it has no biocidal claims, it has no certifications, and you cannot guarantee that it's going to work and be effective at protecting you. So it's really, really important that you check those sort of things. And as I say, that temporary exemption is now over and they should be removed from the market. So I'll now hand you back over to Damien, and he'll go through some specific hygiene principles that you can implement in your homes.
Okay, thank you, Martin. Thank you for demystifying the science behind everything. It does get very confusing, especially with all the current changes we're going under at the moment. So I'm going to focus now on ensuring safe operations. With the recent changes that have taken place or about to take place, depending where your homes are or home is, there is now an added risk that relatives can visit their loved ones again. So first of all, we need to understand the risks. So we know the virus may enter your home via staff, visitors, residents, or relatives. And a UCLA study suggests that eliminating cross-traffic between nursing homes could have reduced COVID-19 infections in nursing homes by 44%. Now, that's great that we've learned from that, but what do we need to make sure that we put things into practice going forward? As you think about reopening to relatives, it's important to understand the risk factors. The risk of COVID-19 will remain until there is a viable vaccination for all the strains and everyone has received it. It's also worth noting that nothing gives a 100% guarantee that you won't catch it or spread it. As you most likely already know, the virus is transmitted between people through virus-laden respiratory droplets. This is why face masks are so important and recommended to be worn. These droplets can contaminate environmental surfaces, which can transfer to a person through the mouth, nose, or eyes. This is why hand washing and regular cleaning of frequent touch points should be a focus as well. We should all know the practice these rules, but it's clear people are fed up or getting complacent with them. It's interesting that good ventilation is now a key focus. Studies were carried out at the start of the pandemic, proving that the virus can be carried in moving air for many meters, infecting other people. This knowledge can be used to our advantage. So as hot air rises, it will carry the virus. So if a window is open, the hot air will be drawn out to the colder air outside, thereby reducing the virus droplets in the room. The term droplets can be misleading as we tend to think of fine rain. They're much finer than that, so fine that they can't even be seen by the human eye. This, of course, can work to our advantage, as they will be picked up and removed by the flowing air. To be safe, it's advisable not to sit below or in front of an open window, as this is where the droplets will be taken through. If your home has quarter lights in the top of the windows, it's better to have these open rather than a larger window lower down, as the air will be moving up and along the ceiling to the outside, so there's less risk of cross-contamination. As we know, more and more people are wearing gloves than before, but do they pay attention on how they put them on? If someone didn't wash their hands before putting on their gloves, they could contaminate the glove box, as you can see on the left-hand side in step 2. This would mean the contaminated hand is now inside the glove, which is fine, it's protected, you might say, until step 5, when the gloved hand is used to hold the box, then the glove could be contaminated. You can see in the image that the wrist part of the gloved hand is used to hold the box if necessary. So removing gloves is also possible an area for cross-contamination. Removing a glove from the cuff and turning it inside out will contain any virus, so it can be disposed of out of harm's way. And washing your hands after taking off your gloves is just good hygiene practice, ensuring any powder or sweat is removed from your hands. Now, face masks are an interesting topic. For some, it's become a fashion statement, which is all well and good because people are wearing a mask. But is the mask effective? Unless you're wearing an N95 or FFP2 or FFP3 class mask, you're only protecting others. An ideal cloth mask would be made up of 3 layers, 2 of which would be tightly woven cotton. A stretchy fabric is not recommended as the gaps between the fibers get larger as the fabric stretches, reducing its effectiveness. As the chart suggests, remove your mask using the ear straps, don't pull it off from the front, and don't put it in your pocket for next time. If you do need to save it for next time, or you're going to launder it, if it's a washable mask, then put it in a paper bag rather than a plastic bag. And of course, if it's a single-use mask, like the blue paper hospital type ones, it should be used and then disposed of carefully. Another area you need to watch out for is how people are wearing masks. Masks are only an effective barrier if the correct type of mask and it's worn correctly. You only have to watch the television where it shows people wearing masks to see the same examples I'm showing here on how not to wear a mask. It's also bad practice to keep touching the mask, as this will lead to contamination of your hands, so make sure your mask is the correct fit for you when you first put it on. There's so many extra things to look out for, so to help keep everyone safe, we've produced some support signs to help you with this, and I'll show you where to find this at the end of this webinar. Public health recommendations focus on standard infection control practices, training and compliance. There are 2 critical considerations to infection control: personal and environmental hygiene. When implemented correctly, they are the winning combination, especially during this COVID-19 time. It's important to communicate the expectations for personal hygiene for both staff and guests. Signage can be a great way to ensure everyone is aware of the need to wash their hands frequently and to encourage physical distancing of at least 2 meters. Signage can also communicate the requirements for any PPE on premises. For example, you may have a requirement that guests wear masks in public areas. The second consideration, environmental hygiene, is equally as important as personal hygiene. This is the focus on the proper cleaning and disinfection of high-touch surfaces and objects with an EM-registered disinfectant approved to be used against COVID-19. Overall, the best practice to mitigate the risk of COVID-19 is to implement enhanced hygiene through standard infection control practices, training and compliance. This starts with the correct way to wash your hands. Hopefully, we all know the correct process to wash our hands. We need to wash them for at least 20 seconds to ensure soap has destroyed the virus envelope that protects it and you've flushed the remains down the drain. Ask yourself a question. Are you still counting 20 seconds or singing happy birthday twice to yourself each and every time you wash your hands? As Martin mentioned earlier, contact time is important. If it hasn't had time to work, then it will be ineffective. So most people are turning to alcohol-based sanitizers to sanitize their hands because they think it's quicker than washing your hands. Well, actually, it takes 30 seconds of being wet on your hands to work, which is 10 seconds longer than washing your hands with just soap. Just think about this when relatives come through your front door. They use a sanitizer station and give them a 5-second rub. And in some cases, I've even seen people wiping any remains of the sanitizer on the clothing. So again, people are assuming that the sanitizer works quicker than washing your hands, and it's the opposite. You use a sanitizer if soap and water aren't available. It's therefore fairly safe to assume that not everyone entering will sanitize their hands properly. This means you and your staff will need to be more vigilant regarding high touch points disinfection. What you can see on the screen now is an example of some of the areas to focus on. And again, I'll show you where you can download these guides at the end of the webinar. You should consider and document frequency of cleaning and disinfection in your reopening plans. This is a decision that could be made at the unit level or mandated at corporate level, but regardless, it should be re-evaluated as environmental variable changes. An infection risk, foot traffic, soil load increases, so should the frequency of cleaning and disinfection. Translated, this simply means when you reopen to relatives, the infection risk may be higher. This requires an evaluation of standard operation procedures pre-opening to relatives to understand if they're still appropriate to protect your employees and residents. Likely, you'll want to employ more frequent cleaning and disinfection until the risk begins to subside. Having the best product in the world won't be effective if procedures are incorrect. How many adverts have you seen where someone is sanitizing a shopping trolley with a quick spray and immediate wipe of a cloth? The product, no matter what it is, will be totally ineffective for that short contact time and lack of physical rubbing action. So what is the most effective method for use for disinfecting? So look at disinfecting a non-food contact surface. There are several steps to using a disinfectant. A pre-clean step may be required if there's visible soil such as food or dirt. Sometimes it can't be seen that much. It could be fingerprints, grease off your hands. That could be enough dirt to eliminate the efficiency and effectiveness of the sanitizer that you're going to use. There are some products out there that can clean and disinfect in one go, like dry Sanoxy, for instance. The disinfectant can then be applied according to the label directions, either by spraying or through immersion, which is using a mop or a cloth. The most critical step to achieving disinfection is step 3, which is wait. This is an example of how important it is to let the tool do its job. In this case, the tool is the disinfectant. You only achieve disinfection when the treated surface remains wet for the contact time listed on the product label. If you're unsure, reach out to your Ecolab TM or your ARPL CSR. They'll guide you through this. This is where you need to understand the required contact time, sometimes referred to as the kill time or dwell time. The surface must remain wet for the duration of this time, which in some cases may mean reapplication of the products to achieve that longer contact time. Finally, wipe the surface or allow it to air dry. Note that in order to actually clean, that's remove the soil from the surface, it's important to wipe afterwards. Looking now at disinfecting a food contact surface, it's the same process but with an added step. So not only do you need to have the correct product type, remember Martin talked about PT2 for the front of house and PT4 for food areas, the contact times may be longer to destroy the bacteria than the virus. With food contact surfaces, there's an additional rinse step, unless of course you're using an alcohol-based product. There are various ways to spray on a product, either through a manual trigger spray or an electrostatic sprayer. Electrostatic sprayers are gaining traction in many markets, including facilities where large areas have to be covered quickly and effectively. These devices apply an electric charge to the liquid particles, causing the droplets to be attracted to the surface. This allows for a far more uniform and comprehensive coverage of the surfaces. Electrostatic sprayers should not be confused with foggers or misters, which fall under separate regulations. There are some special considerations when using an electrostatic sprayer. For example, ensuring the internal components are compatible with the chemistry, that the proper nozzle size is utilized to give the correct size of droplet for this type of approved application, so you aren't breaking the law, and the correct PPE is worn. And also that surfaces are sprayed from a distance of no greater than 2 feet. If you plan on applying your chemistry using this method, please make sure you use a registered product for this process. The majority of products on the market have not been approved for this type of application, or for fogging or for misting. If you're unsure, your Ecolab TM or ARPL CSR will be able to guide you through this process. So one of the most frequently asked questions over the course of the last few months has been about cleaning soft or porous surfaces such as upholstery or curtains. Early research has demonstrated that this virus may only be viable for 24 hours on a soft surface. With this in mind, the following protocol is recommended for handling soft surfaces. So either remove the visible contamination and clean the surface using soap and water, or with a cleaner appropriate for that use or service type. Or launder the items if possible, according to manufacturer's instructions. We'll look at laundry shortly. Or steam cleaning is the most recommended way. Again, different fabrics have different limitations of what you can and can't do with them. In our final section, we look at the best practice to use in your home to keep everyone safe, be it residents, staff, visitors, or relatives. There are many ways to assure your staff, residents, visitors, and relatives as you begin the steps of allowing relatives to visit. Increase frequency of cleaning and disinfection in public spaces during the high traffic periods to increase visibility of these tasks. Script a message for your staff to share with visitors or new or prospective residents. Communicate new cleaning standards through your website or via email or newsletter to residents and their families. Provide on-property messaging and signage to provide reminders and communicate your commitment to cleanliness. Be clear about expectations for behaviour of residents and guests in common areas with obvious signage as in wearing masks, keeping distance, washing hands procedures, etc. Where available, provide hand sanitizer at visitor check-in, as well as in high traffic areas that do not have access to soap and water. Provide disinfectant or cloths or disinfecting wipes in public areas for use by employees or residents to encourage a heightened sanitation. Consider providing an opportunity for residents, visitors and employees and relatives to provide feedback on the cleanliness of your operation to reinforce your commitment to their well-being. And we have produced many free job aids to help you. I'll give you a quick overview of them. So this one is an example of one for public areas, which covers the product types that are needed, a reminder of specific touch points and best practices, such as focus on disinfection on high-touch, hard, non-porous surfaces, ensuring treated surfaces remain wet for the proper contact time. Disinfection should be most frequent in public areas, especially those with high traffic. The current recommendations are that these areas are disinfected multiple times per day at a minimum. Risk factors in here and your operation may opt to disinfect more often. Disinfect surfaces after each guest interaction, such as the reception area, using the toilet, shared seating areas, etc. Other considerations should be markings on floors to encourage social distancing and signage for the use of PPE, whether it be gloves or mask or whatever procedures you want to put into place. I'm moving on to the job aids, which will show you some examples of what are available. This is some examples for public spaces, along with a touch-free freestanding sanitizer stands to help eliminate cross-contamination from the pump action sanitizer bottles, and at the same time as giving the correct dosage to destroy the virus on hands. As I mentioned earlier, it's important to have the product in contact time for the correct period of time, and to do that you've got to have the right volume of product to achieve that. Moving on to the residents' rooms and bathrooms, extra attention will be needed if the relatives are entering these areas for their visits. One of the critical areas is the laundry, which includes collection and transport from the residents' rooms. Viruses aren't the only watch out for a laundry area. There is, of course, the red bag contaminated items, so staff will be aware and have to keep both of these under control. Food delivery relates to how the food is taken to the eating area and the eating area itself, including any vending machines. High touch point areas that is often overlooked as the seat runners, the part that people tend to touch when they're adjusting their chair to or from the table. Not forgetting the kitchen. This is where we mustn't forget about the risk of illness from bacteria as well as from the virus. This area is critical in using the correct product that will cover all the needs for both to the correct standard. Sometimes there's confusion, so we're focused on killing the virus, we forget about the bacteria. This usually needs a longer contact time to destroy it. And not all sanitizers are approved for the food use areas. So this is where your Ecolab TM or your ARPL CSR can support you by giving you the correct advice to ensure you keep everyone in or who visits your home safe and well. To gain free access to this support material, whether you are a customer or not, if you just go on to ecolab.com site. You'll see the strapline banner come up. So look and navigate to the COVID-19 guidance page. Select more COVID-19 information. Scroll down and choose a long-term care button. Scroll down to the 4 options and select the area that you want. Clicking onto the resource portal, which is the one furthest one on the right-hand side, will take you to the cleaning guides that I've shown you. Other information regarding hygiene solutions and task cards, contact your Ecolab TM or your ARPL CSR, and they'll be happy to help you. So that concludes the presentation. I'm now going to open it up for questions. So if I'll just have a quick look to see if we've got any hands raised, or indeed if we've got anything in the chat. Okay, so I'm just seeing one in the chat. There appears to be a lot of products available on the market that claim they can destroy the virus, and services remain free from viruses for hours afterwards. How long are your products active for after application? So I'll pass that one to you, Martin.
Okay, thanks, David. I guess probably the first thing to state is that when we're talking about EN norms at the beginning of this presentation, is that there's no EN norm, so no standard for testing that a product has a residual claim. So an EN norm will only cover the product for when it is being used and the process it's being used in. It won't cover it after that process for a period of time. So I guess what I'm trying to say is there's no compliant way of making a claim of residual protection. Really, the critical point of all of the advice that's been coming out from different regulatory authorities, whether it's the government or whether it's organisations like the WHO, the focus really should be put on frequency of clean. You can only guarantee that a surface is free of virus and free of contamination risk the moment after it has been cleaned. The reality is that if someone comes along and breathes on it and touches it afterwards, regardless of the claims that the product might make, you can't make any guarantees that that surface is still safe. So really, I would encourage a focus on increasing frequency, doing the right procedures during that cleaning process, and also focusing on your high touch points for disinfection as well. So targeting that disinfection if you haven't got a product that's capable of doing cleaning and disinfection as a combined step everywhere. So hopefully that answers the question. Yeah, there's no efficacy standard for residual claims.
Okay, thank you, Martin. We have another question. I'll probably point in your direction as well. I have a lot of soft furnishings like armchairs that are high touch points and they can't be laundered. What do you recommend I clean these with?
Okay, yeah, another good question. So Damien kind of covered the, you know, as more data has been coming out about this virus, that the risk associated with soft furnishings is considered to be relatively low. But still, the same principles apply as what we were talking about before. And you know, if you feel through doing your risk assessment there is a risk with soft furnishings, then it's a case of increasing frequency of clean. So using things like vacuums with HEPA filters will help, but also as well you can resort to things like steam cleaning. The difficulty we've got from a biocidal approach is that the majority of EN norms are relevant to non-porous surfaces, so surfaces which are not going to absorb the product. Now, obviously, this is completely different for textiles. They do absorb the product. So the only way that you'd be able to transfer that sort of efficacy data onto textiles would be if you completely submerged them and completely soaked. And the reality is that that's not something that's going to do the textiles an awful lot of good. It could damage them, but also it's not particularly practical to do that on a frequent basis to completely soak things. So again, it's kind of focusing on mitigating risk, targeting your resources. Soft furnishing is not considered a huge risk, but just make sure you're keeping them clean. And if you do want to go that step further, then invest in something like a steam cleaning machine.
Okay, I'm going to keep these questions coming to you, Martin, for what I can see. Okay. You mentioned that you should remove dirt before sanitizing. What do you consider to be dirt? And do you have a product that will clean and disinfect in one go?
Okay, right. So that is a really good question. So dirt is often it can be a little bit of a confusing term, because obviously we have a perception of what is dirty and what is clean from our personal lives, and what we would accept as being clean and dirty. It will vary from one person to another. But really, when we're talking about dirt from a biocidal perspective, we're talking about anything that on that surface which could interfere with the product. So that could be something that is really quite small and hard to see with your eye. So we're talking about things like grease from someone's hand. It could be product from someone's hand. It could be any sorts of fats and oils, or it could actually be some physical soils from food, such as proteins or starch. So really, we're talking about anything on there. So really, what I would say to you is, if you're going to be employing a product that's only certified for clean conditions, then you need to always assume that the surface is dirty. Okay, so you always need to pre-clean it with a detergent first. And then you need to rinse that detergent afterwards, and then apply the biocide. Now, what we see more and more as technology improves is that we see combined products, and the majority of the products that we offer are combined products. And these are products which have a biocide, and they also have a detergent in. So what that means is that they can cut through a level of soil and lift that soil off, and also the biocide can work in a singular process. And you'll see that on the back of the label, that you'll see an EN standard, some efficacy data, and then it will say dirty conditions afterwards. So that's really important. It's really important as well in care homes, that if you're going to be using things like chlorine, that if you're using chlorine releasing tablets, if you're going to be doing it as a one-stage process, then you need to be looking at products which are approved for dirty conditions, so have a detergent in. If they haven't got a detergent in and it's just chlorine, then you need to pre-clean that surface first. So it's really, really important. And there's a wide variety of products that we can offer, which are compatible with different types of surfaces and have different contact times. And I would just direct you towards your Apple CSR or your Ecolab TM for further advice on that.
Great, thank you, Martin. Good advice. And I think the final question, unless another one pops up. I've read a lot about fogging areas to kill the virus. Is this process effective?
Okay, yeah, another really good question, and quite a contentious subject. So foggers have made a bit of a resurgence in the last year or so. We kind of saw that it was a movement away from foggers over the past sort of probably 15 years or so. The strict guidance from the regulatory authorities in the UK is that the manufacturer has the responsibility to prove that their product is safe and effective for the way in which they're recommending it to be used. Now, what that means specifically for fogging is that the manufacturer needs to have conducted some testing in a lab environment to prove that the product is effective when applied in that method, but also that it's safe for the user. Now, specifically for fogging, that would include identifying any of the pre-process tasks you need to do. So how you would isolate the room, what surfaces are appropriate for that product to contact, how you shut down the HVAC system, whether you need to cover up all your air vents, that sort of stuff. If they aren't providing you with that data, then it's probably safe to assume that they haven't done the testing and the product shouldn't be used for that application. I can say that probably as a declaration of interest here, but Ecolab don't offer any products for fogging. It's not a practice that we endorse in this market segment. We do offer specialist divisions within clinical environments, but this is a big process. It's quite expensive, and it's also very, very specialist. The level of disinfection that we should be looking at in our environment is really looking at touch points and also looking at the individuals coming in. As we touched on before, the virus doesn't last for a particularly long time on hard surfaces. So often isolating the room and disinfecting touch points is more than sufficient. Now, Damien talked about electrostatic sprayers. That's a new technology which has come onto the market and is something that we do offer products for. This really should be seen as just a different method of applying some existing chemicals and existing biocides. But still, again, because it's a different method, we need to go through the process of proving that they're safe and effective. So again, there should be lab data that backs them up. Your manufacturer and your supplier should be able to provide that for you. And they should also be able to provide you with details of the precautions you need to put in place. So I can say for Ecolab products, that would be wearing an FFP2 mask for 15 minutes after you've applied the product. And it would also be wearing goggles and gloves. But yeah, that's the sort of information you should be provided. And just because you're using the same product for fogging or spraying as you would in the spray bottle, doesn't mean that there's the same risks associated with it. You need very different procedures. And as I say, your manufacturer should be able to support you with that.
Okay, thank you, Martin. Well, I can't see any hands raised or any more questions in the chat box. So we'll hope that we've answered everything for you. If not, you can always reach out to your Ecolab TM or your ARPL CSR, and they'll be happy to help. So I'd like to thank you for joining us today on this webinar, and we look forward to seeing you on future webinars. So thank you very much. You're free to leave and enjoy your afternoon. Thank you.
Thank you, everyone.